When we're hospitalized, we expect to be treated with kindness, respect, and empathy. We want to hear helpful words, that people care, that people believe that we will get better. It's especially important if we are hospitalized for a mental illness. There is already so much misinformation, stigmatizing attitudes, and isolation. Hear for yourself about how you can help. Hear for yourself that people can get better and recover.
I was in the hospital frequently during the course of my illness. They diagnosed my bipolar as rapid cycling. So about every 3 months, I would be hospitalized again for my symptoms. I think that my treatment maybe wasn't the standard because I'm a nurse, and they knew I was a nurse. And so they were aware that I knew what they should be doing. And as a result, I think they took more care with my care. They answered any questions that I had, and they answered them in a language that I could understand, although it might not be a language that the lay patient could understand.
I have had some less than helpful experiences as an inpatient, and was really struggling with symptoms and having a hard time finding a medication routine that would work for me. People telling me, oh, you are manipulative, you are attention-seeking, you keep coming back here because you just want people to pay attention to you. You just need to, grow up and, get a life. And I would say that in a way, I probably was attention-seeking, but the reason that I was attention-seeking was not because I was, childish or did not have needs, but I was seeking attention because I was scared and I was ashamed and I was looking for some way out and some kind of help. I just wanted these symptoms to go away and for me to just be able to go on with the life that I wanted to have for myself.
Well, the first time I was in the hospital, the doctor looked at me and I said, I'm having a religious experience. And he said, you're schizophrenic. That's an example of something that wasn't so helpful because I was trying hard to hang on to what reality I knew as. And he was, kind of assumed almost an antagonist kind of point of view. And that didn't go over so well. But then the second psychiatrist I had, my second hospitalization, was very professional. He kind of more or less slowly guided me into really being able to assess what was reality. Because my biggest problem was I had this big delusion that people were depending upon me to save the world. And he kind of knew what weight that carried, and he didn't treat it lightly. He took it quite seriously.
A number of times when I've been in the hospital that I've been sitting out in the day room, I've been very lonely and distressed and feeling bad about myself. And all of the staff and the nurses and the technicians were all behind the nurses station having their own conversation. And I don't begrudge the staff the right to have their own conversations, and I certainly know they have a lot of paperwork to do. And at the same time, I would also say, don't just, do your 15-minute check as much as possible if you can connect with patients as human beings and not just as somebody you got to keep track of. Patients can sense that. They sense when staff view them as less than human, and they internalize that, and it's not at all helpful.
I think some of the best therapists that I've worked with really emphasize trust, hope, helping me understand that I can set goals and meet them, and over time, more and more, my anxiety can decrease, and just making that information available to me, demonstrating, showing, wow, Solmay, you really, look how far you've come so far, and I found that's really encouraged me to keep going.
I have a great family structure, which I'm very fortunate for, a very loving girlfriend, and a great group of friends that I had to open up to first to include them in any sort of discussion about where I was at. It was difficult for me to tell people that I was really sad and unhappy, and once I started to do that, it seemed like everybody then became my biggest supporter, as opposed to me thinking that opening up and being vulnerable was actually going to distance us because it would reduce my, it would counter my image that I had in my head of me being this very strong individual who doesn't need any assistance.
What really started making a difference for me is I went to this woman. She had this big piece of white paper on the table, and next to it she had a little box of finger paints. And I thought, oh my God, this is what my life has come to. She said, please, I'd like you to paint your feelings. And I said, I'm not going to, I won't. And she said, well, it's fine that you feel that way, but we're not leaving this office till you paint something on that paper. So I said, fine, then we're not leaving this office. And we waited, and we waited, and we waited. And finally, I could not stand this woman smiling and staring at me anymore. So I took a whole big glob of finger paint and I threw it on the page and I smeared it around and I shoved it over at her and I said, there, can I go now? And she said, well, how did that make you feel? Better. There's something about releasing that kind of anger, feeling something because I'd been numb for so long. And I wasn't able to express things through words very well at that point, but I could do it through art.
The support that I got as an inpatient in the hospital was pretty good at that time. That first hospitalization was a pretty good experience. I had a case manager who was a registered nurse, and she helped me strategize and plan for how I was going to go back to college and taking psychiatric medication and how to cope emotionally and deal with my diagnosis, and that was very helpful.
One of the things that I found necessary when I was in the hospital is that I would forget things and I would have to ask repeatedly some of the questions. And I think the staff sometimes got tired of that I would ask the same question over and over. Yet I didn't necessarily remember that I had even asked that question before when I was very sick.
I had a roommate in the hospital, actually, who was very supportive of me. She was a young woman also in her teenage years, and she and I connected, and she gave me a lot of support and encouragement. And also, I was fortunate in that I had some peers, some friends at college who did support me after I got out of the hospital to help me reintegrate into college life and make up the work that I'd missed.
The most important thing for somebody with mental illness is to fit into the community and be a part of the community, because if you're left to your own devices, you're probably self-destruct. So I would say, and I always believed in a strong faith position. That's given me a lot of help. It's not for everybody, but a strong faith in something greater than myself was very important.
The problem with inpatient hospitalization is that the nurses and the physicians and all the other folks are seeing people at their worst. People don't go to the hospital to say, look how healthy I am. They go to the hospital and they're like, I'm in distress, I'm scared, I want to hurt myself, please help me. And when a professional sees somebody in that state, it's easy to assume, well, that's what people with mental illness are like. Sometimes we are like that, and that's why we go to the hospital. But we go to the hospital to try to stabilize, try to get better, try to regain the hope that we had from our lives, and to move on from there. And so it's important for the folks who work inpatient to realize what I'm seeing of this person with mental illness is really just a small sliver of their life story. And it's important not to make assumptions based on that small sliver.